Greetings, YouTube. Um, I don't know if I have to repeat this so many times, but healthcare is a human right, period. You have the right to access healthcare. And if it is denied you, then the culture that you live in is committing an atrocity. It's it's really that simple. And of the 33 wealthy nations on the planet, and I understand that they are wealthy because of their problematic past and present. I understand. The problem of solving universal health care is so difficult. Only 32 of them have solved it of the 33. I'm going to give you a little bit of some dystopian horror here for your morning. Private equity acquisitions of hospitals, on average, was associated with increased hospital-acquired adverse events despite a likely lower risk pool of admitted Medicare beneficiaries, suggesting a poorer quality of inpatient care. That's that's a really good spin on saying that they couldn't make enough money off of you, so they let you die. Because that's that's American healthcare in a nutshell. I don't know how many of you who see this video are from countries that actually have functioning healthcare systems. I hope it's many because I really hope that you folks don't live in the dystopian nightmare that I do and many of my fellow Americans do. Um, but our jobs have us by the short hairs because if we lose our jobs, we lose our access to healthcare. That's taking into account the jobs that actually provide healthcare. Um, my wife's in a difficult position because she works a job that isn't 12 months a year. She's a gardener. So in that gap, we have to find a bridge for her, and thankfully her company has helped her with helping her with that bridge. Um, because she doesn't have like the number of required hours to be considered an employee to get the healthcare program, provided by her job. But I have healthcare, and I'm able to help her supplement hers because hers is not as comprehensive as mine is, and which is good. And of the two of us, I tend to have the higher healthcare requirements. I'm diabetic. I have mental illness. Uh, of neuropathy and retinopathy, high blood pressure, cholesterol. Though those two things are pretty much under control at this point. Um, but I do take a lot of medications. I got no choice. I take things for pain meds because of my neuropathy. I take antidepressants. I take uh, the medications that I do at the very small dose of medications to regulate the other things I've got wrong with me. I take metformin because I'm a diabetic. These are things I have to take every single day. And without my health care, I wouldn't be able to cover them. But now we have equity firms. Equity firms have decided that it would make the most sense for America if they could just squeeze out a few more pennies out of us as they drive us into an early grave. Because that's the ideal, have a person pay into their insurance, use it as little as possible because Americans are terrified of being engaging with their medical, the healthcare system because of the costs. And then when you get to the point in life when you are actually going to need a higher degree of healthcare as you get older, I mean, I'm 59, uh, then, you just die. That's the ultimate perfect outcome for the healthcare system in America. Get sick, die. Don't be a drain on the system. Don't knock the profit sharing that's available to the beneficiaries of equity firms, of those that have invested in them. Uh, don't damage the shareholder expectations on each quarter. So yeah, it's horrible, and it disgusts me that this is where we are, because again, Healthcare is a human right. And if you are being denied it, that is an act of uh, unconscionable atrocities. That is 68,000 people in America die every year because they don't have access to healthcare. 68,000 people. How many people live in the city you live in right now? You live in a big place, you live in a small place. What percentage of your city is 68,000 people? That's how many people die every year. That's half the population of where I live. So half the population of my city would die every single year because we don't have health care. There would literally be bodies lying in the street because we couldn't move them out fast enough. And we think that's okay in America. We're just A-okay with that. This is the only nation on the planet I can think of where poor people who are literally dying because they don't have access to health care have been convinced by billionaires and equity firms to do everything in their power to vote against their best interests and keep putting people into power who are going to continue to make sure they don't have health care. I know that the Stockholm Syndrome is BS, but we have to come up with a name for what Americans are doing when it comes to suckling the teats of capitalists and thinking that they're ever going to give us anything that we need to survive. I am tired of my fellow Americans licking the boots of capitalists and telling me it's tasty because it isn't. Healthcare is a human right. And in America, we need to fix this shit.